Good afternoon, everyone. Thank you all for being here this afternoon on short notice. We appreciate that. Clearly, we are here today to talk about COVID-19. I think all of you know that. And in the city of St. Louis, in the region here, but even more importantly, across the country and across the world. I'd like to take a minute, if I could, just to have everyone here introduce themselves. This is the team that has been working on this continuously, more lately than previously, to address our response to COVID-19. So, Frank, can you start?
I'm Frank Oswald. I'm the city's building commissioner.
Christina Davis, Health Service Administrator for the city jails.
Nathan Graves, I'm the circuit court administrator.
Dennis Jaggerson, St. Louis City Fire Chief.
Rex Burleson, Chief of the 22nd Judicial Circuit Court.
John Hayden, Chief of Police.
Fred Elkins, Director of Health.
Kim Gardner, Circuit Attorney, City of St. Louis.
Jimmy Edwards, Director of Public Safety.
Newton McCoy, Administrative Judge of City Courts.
Richard Torak, City Court Administrator.
Gary Crispin, Commissioner of Emergency Management for City of St. Louis.
Michael Brown, Deputy Superintendent, St. Louis Public Schools.
Lori Willis, Deputy Superintendent, St. Louis Public Schools.
Richard?
Richard Torak, St. Louis City Court
Did you
Administrator.
already do that? I'm sorry. All right. Sorry. Thank you all for being here. As I mentioned a minute ago, we are here today to talk about the rapid spread of COVID-19 and what the city of St. Louis is doing about that right now in order to fight it. At this time, we do only have one confirmed case. It's in St. Louis County. The city of St. Louis doesn't have any confirmed cases, but what we know from other countries and from other areas of our own country is that this virus has been spreading very rapidly. The World Health Organization, as you know, declared COVID-19 as a global pandemic. Already in the city of St. Louis and in the region, we have seen many cancellations. Of course, many sporting events, NCAA, hockey, Major League Baseball has postponed. Conventions have canceled. Most large gatherings have canceled their events at this time. It's unknown for how long that will be, but that is where we are today. It's a very evolving situation. It has evolved just since yesterday and the day before that. So those cancellations are it for the immediate future. I do want to say that the vast majority of the colleges and universities in our area have taken some very strong measures. You know that one university has canceled the rest of the semester, at least for on-campus classes. Most universities have canceled in-person classes. We have taken a number of preventative measures here in the city to slow the spread of COVID-19 to the extent that it is here. And of course, we don't know that extent because testing has been limited, but we feel like we have to take these measures anyway in order to prevent that spread. This morning, some of you may have seen that I directed the water department not to do any water shutoffs for either residential or commercial properties for the next 60 days till May the 15th. I did that because obviously one of the things that's being said over and over is wash your hands, use good hygiene, clean your surfaces. Well, you've got to have water in order to be able to do that. So we did that this morning. There won't be any water shutoffs. That doesn't mean you don't have to pay your water bill. It means that your water will not be shut off for the next 60 days. And of course, we'll evaluate all these time frames as we go along. We have also placed hand washing stations throughout the area of downtown. Some of them are even being delivered probably as we speak. These are soap and water hand washing stations for anybody who might not have access to sink and soap and water so that they can do that downtown. Those are being placed as we speak. We've enacted the Unified Health Command to ensure the timely sharing of information. This is across, I believe it is 18 jurisdictions here. So that has been stood up. We have communicated with our city employees just about an hour ago, maybe. City employees all received an email that talked to them about how to prevent, talked to them about what to do if they feel that they have been exposed and are symptomatic, and who to contact, which would of course be their medical doctor. If they don't have a medical doctor, it would be to contact the city health department, and so that we can determine if they need testing and provide for that situation. We know that this virus disproportionately affects older people. And so I would say to you, reach out to your older neighbors, family members, friends, to try to give them the information that they need in order to not be afraid. Couple of other things I wanted to mention to you. On Election Day, I think you know we provided hand sanitizer to all the polling places. That turned out to be a very welcome thing in some polling places that might not have otherwise had it, and that was just as a preventative tool. I mentioned the water department won't be shutting off water. The other thing that I announced today in the message to employees is that anyone who does have to be voluntarily quarantined, in other words, they've been directed by their doctor or our health director to quarantine, and that would happen as a result of potential exposure and symptoms. If they've been directed to quarantine, the city will pay them for the days that they're quarantined without them having to use their sick time. We don't expect that will be a lot of people. We certainly hope it's not a lot of people. That's why we're putting these measures in place. But to the extent that someone has been quarantined, that means stay at home. You, all your family members, whoever is in your household, stay at home. Don't go to church. Don't go to the grocery store. Don't go out of your house. Those folks would be paid for that time off. There are a lot of other people here who have a lot of information, and I want to let them speak, certainly. And I think the first person who ought to speak here is Dr. Fred Eccles. We are very pleased to have Dr. Eccles as the head of our health department. Some of you may know this, but it's been about a dozen years, give or take, since the city of St. Louis has had a medical doctor in charge of our health department. And I'm going to just tell you right now, I consider that a stroke of luck, maybe not a stroke of genius, but we are so pleased that he is here. So I'm going to turn this over to Dr. Eccles. A few other people will also speak, and then, of course, we'll take your questions. Dr. Eccles?
All right, thank you, Mayor, for those remarks. As you mentioned, we're really monitoring this situation very closely. As everyone knows, there's community spread in other areas of the United States, and so it's really not a question of if, but when we have a case in the city of St. Louis, and we're working diligently across sectors, across the region, to make sure we're properly prepared. As you can see here, we have a lot of stakeholders that are engaged and involved in our response, and it's really important for everyone to know that although they may not see efforts being out in public, there's a lot of work being done behind the scenes. We're working really closely, not only with these stakeholders, but also academic institutions, community-based organizations, also private industry individuals, organizations, to make sure, again, that we have the resources we need to provide a proper response in the event that a case is detected in the city of St. Louis. Within the health department, we have several components of several programs within the department that are also playing a critical role in this response. One is our communicable disease control program. So they're the ones that are responsible for making sure individuals that have that report being exposed to a confirmed case or report being traveling to in areas where there's ongoing transmission, we make sure that they are properly monitored according to guidelines that have been established by the Center for Disease Control and Prevention. In addition to that, we also have our emergency preparedness program staff who are really engaged in working with our stakeholders, particularly non-traditional stakeholders that haven't been engaged by the health department before. So city venues, other community-based organizations and academic institutions. Again, we're working with them really closely to make sure they have the information they need. We're also taking the time to inquire about their readiness, so whether or not they have emergency operation plans in place. If they don't, we're assisting them with actually developing those plans and actually reviewing them. If they do have plans in place, we're reviewing those plans, addressing any identified areas of improvement, and working with them to make sure their plans are up to date and meet national standards. We have a group of stakeholders. Again, we have communication is a really important piece of our response. So there's a lot of misinformation that's circulating, social media, the web, TV, et cetera. So we're working really closely with all media outlets across the St. Louis region to make sure accurate information is available to not only laypersons in the community, but also medical providers, academic institutions as well. And this is important because there's specific guidance that has been issued by the Centers for Disease Control for businesses, academic institutions, including primary, secondary, and tertiary institutions, as well as government agencies. And so we want to make sure everyone in the city of St. Louis has accurate information at their fingertips. And so what we've done is we've posted this information on the City of St. Louis Department of Health's website. This information, again, is ready, available 24/7, and it reflects, it links individuals to the most current information that's been published by the Centers for Disease Control and Prevention. Furthermore, one of the things that we're also responsible for is making sure we limit or prevent the spread of COVID-19 when we do get a case in the city of St. Louis. And so one way to do that is really to limit the size of gatherings in our jurisdiction. So today, as the director of the Department of Health for the city of St. Louis, and under my emergency powers, I declare that any event in excess of 1,000 people shall be prohibited with the exception of religious services until further notice. And this does not include day-to-day operations such as schools, academic institutions, et cetera, but any event in the excess of 1,000 people strictly prohibited until further notice. And I'll turn it back over to the mayor.
Judge Edwards.
The hope here is to help stem the spread of COVID-19 and to implement precautions in furtherance of public health and public safety. As a result of that, we have our police department, our fire department, paramedics, EMS, all prepared to proceed in a safe manner. Additionally, we have our court partners. We have our circuit attorney, as well as the presiding judge of the circuit court. We have our city court presiding judge here to address issues as it relates to court and jurors, as well as the general public. Also present is a member of Corizon, which is our medical staff inside of corrections. We have ensured that we have made the medical unit within our jails ready to address any situation involving influenza and or COVID. We have also had a conversation with the state public defender, Mary Fox, with respect to how our detainees inside of our jails will communicate outside. We have limited visits inside of our facility to 2 days a week instead of 7 days a week. There will be no contact visits within our facility except for attorney-client visits. We've had conversations with the public schools, with Dr. Adams, and members of the St. Louis Public School staff are here if there are questions with respect to students within the public schools. I last talked to Dr. Adams last night with respect to spring break. Spring break is next week with respect to children within the public schools. And we understand that should spring break is extended, there will be accommodations made for children in terms of feeding them and in terms of keeping them safe. We are constrained by law under the HIPAA rules and other statutes with respect to the privacy of many individuals under the Public Safety Department. We will maintain their privacies. We will do our jobs within the boundaries of the law. Thank you. Thank you.
Well, just briefly, as far as the 22nd Judicial Circuit, we've been in contact the last 10 days with a number of the agencies. About all that I need to say as far as the courts, there's three different categories of people that I need to talk about. The first are the jurors. It'll be business as usual until we're told that business will be modified. On your jury summons, you have a phone number that will get you to a recorded message. The jury supervisor can be called directly to get a live voice. Essentially, we are going to interview everyone who comes in the courtroom or courthouse Monday for jury duty. Talk to them about the possibility of them having symptoms as recognized by the Center of Disease Control, and if they do, we're going to send them home. Those that's past that stage, we are going to seclude them in various areas of the courthouse with 6-foot intervals, and to keep them so we can have enough jurors to keep business going. We're going to reprioritize the cases so that the higher end cases will get the jurors, and we'll try to keep that area of the business moving. The second area are the lawyers. The lawyers should be in touch with their clients. Anyone who has any symptoms, our focus is going to be the reduction of exposure, so we'll be continuing cases. Just all we need is that information from the attorneys. And witnesses, if you're under subpoena, call the attorney who has subpoenaed you and find out, or tell that attorney if you have a symptom or a reason not to appear in court, and we'll be very liberal in rescheduling those cases and those appearances in order to minimize the congregation of people. We have also asked our court administrator to fund additional janitorial services. We expect to have all floors of the courtrooms on both sides of the Market Street wiped down 2 times per day. We will have other hand washings, and we will have staff that we're asking to be very diligent in talking to people about any symptoms that they may see that person is experiencing. Thanks for the opportunity.
Thank you. Thank you. Circuit Attorney Kim Gardner.
Just want to thank you for being here because, as you know, this is serious. And to be the circuit attorney, but also to be a registered nurse, I want to thank Dr. Eccles for giving us the tools to be educated, and the mayor for allowing us to be here to work together with the police chief and law enforcement and former Judge Jimmy Edwards and the court personnel, because it's key to prevent any exposure from the public as well as our lawyers, but to maintain due process and safety for everyone inside the courtrooms, for judges, court personnel. So we're looking forward to working with each and every partner up here and other partners in the community for education purposes of how do we address exposure, prevention. At the same time, how do we address education? Because there's a lot of miseducation going out in the public, as well as how we keep the courts going and, like the judge says, due process of cases. And it's about fairness, safety for everyone, victims, witnesses, and law enforcement, which we don't get a day off. And so we want to make sure we have a plan for first responders that is appropriate when they're sick, how we keep them the day-to-day working and moving, which we look forward to having a more comprehensive plan and working together. So thank you.
Thank you. We're going to hear from Fire Chief Dennis Jenkerson now, who of course is fire department and EMS, so a very important component.
Thank you, Mayor. First off, I want to start to remind everybody just to stay calm. The city is prepared for this. We've been through different viruses before. The fire department, the EMS department, we've been through this. We started active surveillance on January 24th on the fire department side when we were receiving the calls from people who were worried about it. So we've been dealing with it for a while. So far, everybody has remained calm. What I want to tell you is we've changed a few of our protocols, mostly how we react when people call. You know, we're not going to rush into the home and touch somebody to feel how warm they are. We do keep our distance. We're checking on them. More importantly, before we get to the house, you're going to be asked several questions over the phone using an active surveillance tool that we have. And we bring the people through the different questions, trying to decide at what risk they're at and at what risk we're at. Okay? We're receiving about 8 to 10 calls a day with primarily people who have the flu, but they are still concerned with what they have. So, like I said before, just remain calm. If you have questions, you can go to any website, to the CDC website, and those questions will be answered. If you are still concerned, you can call 911, and we'll walk you through the program. We only have one confirmed case, as the mayor said. It's in the county. Right now, the City of St. Louis Fire and EMS Department, we are prepared. Our supplies are where they should be. We have no issue at this time. So I'm very confident that with all the department heads and everything that's going on right now, we will get through this.
Chief Hayden?
I just want to assure the public that all of our response protocols are the same, so we have not changed how we respond to calls. Of course, our officers are equipped with personal protective equipment that includes eyewear, respirators, and gloves. But at the same time, we are full on with respect to our response to calls. At this point, we are responding to all calls as we always have.
Okay, I just want to close by saying that this is a very challenging situation and a very fluid situation. What we know now is, and the decisions that we've made over the last day and a half are different than what we knew 3 days ago or 5 days ago or 7 days ago. So we will continue to make good decisions, keep you updated, keep the public updated as this situation progresses. The other thing I will say is that this is a pretty devastating situation for many of our businesses and for many of our workers. When you have large events that are canceled, we did not make that decision lightly, I will tell you. It was a very tough decision to make because we know the impact that it has on the people who then don't get the hours to go to work, or the folks who are not earning the living that they were, and on the businesses, both small and large. I mean, this runs the gamut from airlines, which are being very, very challenged by this situation. Our airport is down about 30% in terms of traffic, just number of people going through the airport, because as you know, folks are canceling trips. But that has a ripple effect through our entire community. So whether it's from the airport to the small coffee shop that is down the street from you, I would just say we do need to go ahead and live our lives, and we do need to, I said this at a neighborhood meeting a couple of nights ago. I was going out to eat after I left the neighborhood meeting, and I said, double tip your server if you can possibly afford it. Because these folks are depending on this income, and we know that through the cancellation of conventions and concerts and sporting events and all of those things have a huge impact on the thousands and thousands of people in our community who work in this hospitality tourism venues. So keep that in mind as you go about your daily lives. Of course, city government is running. We are here. We're running here as usual. All of our offices will be open, and we don't expect that to change. I do want to say, and I should have said it earlier in my remarks, is that I am in regular conversations with County Executive Sam Page as 5 minutes before we walked out here. He also has agreed that we should limit the size of large events. And we agreed that we'd limit that size to 1,000 at this point in time. Most of the large events are scheduled in the city of St. Louis. We have the larger venues. And so we just wanted to make sure that we were in sync on that. This is a unified effort in order to stop the spread.